Well, have you thought about which zirconia implant? I'm talking about full mouth cases, which one is better? And then most likely is 98% patients and dentists prescribe the zirconia. I would say it's 80%. And then they're using the acrylic. But today's I'm going to talking about what is different compared to what is the benefit compared to the zirconia, what is the another option. So this video we're going to show the detail, explain that you don't have any question for that, which is so many people is asking us is what's the difference, and then I fabricated as many our two types of the frame chrome cover underneath, and then top of that a single or the bridge work with cemented make one piece just like that. Okay, and compared to this. So here's the differences. Is number one, the zirconia. I'm not talking about acrylic, which is dental tooth. Inside has a bar, whatever. I'm not talking about that one. That one is, if my tooth, which one do I have to put into my mouth? That is my question all the time to myself to get my best prosthetics. And number one, here's the differences. As the differences is weight. And zirconia is really heavy. Okay, so number one. And number two, zirconia cannot make the thin, just like the teeth. Okay, just like very thin. You cannot make it because if I make the zirconia, number one, zirconia will go into cracking. Number two, and then underneath is tie base or any bar underneath is a fail. Okay, titanium tie base here will going to fail. Underneath bar I have to make the thick, but that one is not, we cannot make the thin as possible. So that's the benefit. And also when patient has the implant side between the implant and implant, we call pontic. The size is over 22 millimeter or 24 millimeter, whatever, that much over it. And usually cracking because sometimes 40 millimeter, 60 millimeter, sometimes I see there's many cases here. We working with so many different cases, with difficult cases from nationwide, 45 different states. So we trying to help the dentist and patient. By the way, I had a lot of patient requests, probably 100 a month, and please write it down. You're really detailed. And if you have a doctors, your doctor have to prescribe what you need. Or if you want us to introduce your areas, so you can mail us mail at lsk121.com, then we can give you our client list as well. So back to the zirconia and the long ponic and the irregular placement has a problem, so we have to make the zirconia really thick. The other one is if I make the zirconia to zirconia, and then just like stone sound, just like when you click together, and then you see tap 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 is literally annoying some people. Okay, so whenever zirconia made the fat lingually, which is I videotape here, whenever using the patient tongue from inside and really bothering and gaggling, that one is the problem too. The other benefit is when implant has a problem, for example, this is very important, sticking out teeth or inward or usually just like that, some reason, okay? I know some dentists said, who place implant, I really don't care, all right? They place implant from maybe different country, I believe so, okay? My job, I'm trying to fix it as much as possible, as close as possible. I'm not a dentist, I'm a lab technician, but I've been making our product, which is called Syton 7 stars, kind of like I'm trying to selling, but I'm trying to helping my client basis, right? They have a problem, okay, but sometimes they don't know. But end of the 6 months, 3 months later, download, and then they have a problem. I don't want that. So I'm trying to fix the issue. That's why I'm talking today. I know I'm trying selling my company, whatever. But anyway, if I were the patient situation, so I can make the very thin, we call Syton 7 star, which is our company product, I can go this one. If anybody can do the chrome cover with the ceramic, okay, top of the zirconia, you can go from there too. You can ask them, not a problem. So we selling about not only functional fitting, zirconia top of that, but we're selling about our passion. So we're trying to make nice as possible, natural as possible. So our restoration just looks like the teeth. Okay, so very thin. So patient has this sticking out the tooth, and then we can slip it. So just like today cases, we make another temporary crown, doctor took down, the screw down, and then they put the temporary, even the 4 implant. Even another benefit is here. 3 implant can do 7-star cases. I know sometimes patient has a failed implant, sometimes patient cannot afford it, sometimes patient have to wait 6 months, whatever, but you don't have to wait. So we made so many 3 implants, right? I mean different versions. So we made the Syton 7-star, and then we can provide it. I made so many good YouTube video, which is daily basis. You can see my entire things, and that's why probably I can get over 700 subscriber right now. The other benefit is the zirconia has a friction, it's a stone to stone, but 7-star has the 2 different cementing top of that, and then it has a tensile strength. That's like mobility is excellent, right? And then it won't break it. And I almost guarantee. So if guarantees, I'm here, so you can contact us. So today's I'm trying to explain what is the benefit, what is the best full mouth implant restoration out there. I know out there is a lot of acrylic, out there is a crystal prototypes, whatever, and then out there the zirconia, out there has a zirconia bar underneath, or out there so they make titanium bar and put it in the composite, the pink area, which is I don't like that, because that one looks like denture. You get a lot of a food stain, won't come out. 7-star is a ceramic, which is hard to do it. That's why it's not many people can do, and also it's aesthetic. That's why. So if I were in my patient situations, if I have a tough implant site sticking out and a bad side, long span panic, I want to get the really super thin. This is the right choice and recommend it for you, because I got so many questioning. They ask me, but I don't have any time to answer them. But today I'm trying to give you the final answer. Several reasons I want to go to this. Not only exceptional aesthetics, there's individual looking restorations, just like ceramic teeth, but it's monolithic. But we know how to control the aesthetics. Long span panic, irregular implant site, sticking out implant site, and the big panic, and the lower teeth or upper teeth is a really heavy grinder, has a good tensile strength, so it won't break then the zirconia. So even though the implant site is for 8 implant, which is not bad, but it's the differences between the huge panic and whenever we had the prototype is really bulky, so we're trying to bring it in that cause the facially a little bit sticking out. So we made a simple single crown like this, right? And then made another one so doctor can use the temporary cement for that. So made it exceptionally thin, okay? Exceptionally thin implant cases. We just finish it. Okay, so we can send it to the doctor's office, and also we made this nice guide as well. Okay, just like that. Okay, and so you can see all my video. So we saved a lot of implant problem and sticking out the problem. So I'm so glad this case is super nice done, and I'm ready to send to Texas. I hope this one is the answer for all of that. Any question, you can feel free to write it down. Questioning. Again, my name is Luke Kahng from LSK 121 Auto Prosthetic. I'm the owner of this dental lab. Okay, appreciate it. Thank you very much, and talk to you soon.